Hello friends, I am Dr.Pavan Kumar, consultant cardiac surgeon working at Lilavati hospital over last 20 years. These times are very difficult times, as you know that we are having a COVID pandemic all over the world. A Chinese virus from Wuhan has affected large population of the world, and there has been a large amount of deaths due to this coronavirus. And this coronavirus has also affected 10 lakh Indian population, and with more than 30,000 deaths. So it's a serious infection which is now rampaging around in the world. As a heart surgeon, I wish to inform you that how this pandemic has affected heart patients are those patients, those who are likely to undergo heart surgeries. In this pandemic, there are a lot of questions people are asking themselves and to the doctors, that how this corona infection is affecting them and how are they going to suffer, especially heart patients. As you know, today is the 4th month of infection. On 22nd March, Prime Minister Narendra Modi had announced lockdown, and we are now in the process of unlock 2 in the last week of the July. During this period, we have observed many complications, many symptoms of all these heart patients. And as you know, that as our knowledge goes, that corona infection also causes problems in the heart. Although it is primarily a lung disease which it causes, with a lot of pneumonia or infections in the lung it causes, but it also affects heart. And we also observe that these patients have hypercoagulability, that means higher clotting rate in their blood system. And anybody who suffers from heart attack disease or any other heart disease, they may likely to undergo a heart attack because of this infection. And at the same time, because of the lockdown, people have stopped doing exercises, their gyms are off, their diet is not under control, and they are not under doctor's observation. So they are also at risk to get a heart attack or any heart-related problem like hypertension or coagulopathies, strokes, like that. Those patients who already have heart disease, whether it is a coronary artery disease or valvular heart disease or hypertension, they are more susceptible to get into trouble or complications. At Lilavati hospital, when lockdown started, we were declared a COVID hospital, but at the same time, being a premier hospital, a tertiary care super specialty hospital, we have isolated our hospital in different sections, and there are special isolated facilities now available in hospital where COVID patients are treated, and with normal patients are being treated at ICU and in wards. And especially for heart patients, we have dedicated separate ICU, separate operation theatre, and we have been performing a large number of heart surgeries and heart disease diagnostics in cardiac catheterization lab. This hospital has been doing 700 to 800 heart operations every year, and although in this pandemic the numbers are little less, but heart patients are still very welcome, and they have been operated upon in this lockdown period also. As we take special precaution in these patients, they come with their COVID test report, and we let them undergo CT scan of the chest so that we are sure that they are not suffering from corona infection, and then we allow heart surgeries to be done. In fact, we have been operating these patients, not only the normal standard operations, but complicated operations have also been done. In these circumstances, there are many people are fearful of not going to hospital, and because of they may catch infection. For those fears, those doubts, we can assure you that we have dedicated separate corridor where the normal fever or cough and cold patients, those who are suspected to have corona disease, are taken through, and once they are diagnosed whether to be having a corona disease infection or not having a COVID infection, then they are admitted to the routine ward. So there is no need, there is no basis of any fear in people's mind that they can catch infection while going to the hospital or meeting a doctor or undergoing investigations or treatment at Lilavati hospital. Also, I want to say that heart surgery in these times are safe to undergo in where the hospital is divided into different sections, and we have been doing heart surgeries regularly in our hospital, and it has been absolutely safe and complication free because we have dedicated operation theatres and dedicated ICU for these patients to undergo. People also have any doubt that is there any chance that there may complications while doing heart surgery or catching an infection during heart surgery. For that matter, I wish to assure all of you that our staff uses PPE kits and total isolation technique even in normal heart surgery patient, those who undergo at our hospital. So there are hardly any chance of infection. There are no chances of getting into any infection, catching an infection or any complications because of the corona infection in patients, those who undergo heart surgeries. And finally, I would like to give a message to all of the patients, those who are suffering from heart disease like coronary artery blocks or heart valvular disease or hypertension or any other heart disease, that don't be fearful of this corona pandemic. First thing, whether if you are suffering from any previous heart disease, please go through your medication properly, arrange a teleconsultation with your cardiologist or a surgeon or a physician to modify your medication, and get your investigations properly done, because you are at risk of getting a heart attack or getting into complications in these difficult times. So please continue your medication. In fact, if you have been advised a bypass surgery or a heart operation, please go ahead and get these operations done at dedicated wherever you've been advised to, and get a heart surgery done, which is safe and secure, and you will be undergoing a complication-free, safe surgery at Lilavati Hospital. Thank you.